We're so glad you're watching live on Lakeside, and just in time to smile. In our Beauty Buzz segment today, we are talking about the keys to a fabulous smile makeover. It's the first thing people notice.
That's so true.
Yeah.
And joining us now with more are the smiling experts, Dr. John Heimke from the Facial Aesthetic Designers and Master Dental Technician of Oral Design from New York City, Peter Kouvaris. Thank you, gentlemen, for sitting down with us. You look very nice.
Well, thank you.
Always.
So let's jump into it. Dr. Heimke, how does your team with Oral Design Master Ceramists lead to really making that fabulous but natural smile?
Well, what's really unique with me teaming over 20 years with Master Oral Design Ceramists is there's only about 100 of these ceramists and a few doctors that belong to the group. So they're really the A-team of dental technicians in the world. And luckily, I've been, for 20 years, been able to work with Peter and Pinkus, and what we do is we look at the face and then we design the smile. Nowadays we use digital smile design, that we talked about before a lot of times on the show, and then we can do a pop-in smile or we can do a simulation. And what we do is basically fine-tune that smile so that we can get that perfect white.
And Peter, talk about what you do. I mean, this is a process, and yes, we've chatted in the past, but for those of you that are just tuning in, I'd love to hear your part in all of this.
Well, it's my part is working. Very fortunate to work with guys like Dr. John Heimke, because he knows exactly what to do. He knows exactly how to approach the patient. He understands facial aesthetics, and he designs the case and makes it easy for me to perform my work. So all I really have to do is just basically follow his lead and just go down the RX and use my expertise to sort of, make it happen for him. Yeah.
I feel like the hardest part is getting the color right?
Sure.
Because you want it to be white, but you want it to look natural.
You don't want the chiclet, know, Ross from Friends.
Definitely not, yeah.
Exactly, exactly.
So how do you do that?
Well, the color is, we pick a color. There's a shade guide, for instance.
Oh.
And
This is our Ivoclar
color
shade guide. And what we have, these are the bleach colors, because most people want nice white teeth. So we start with this.
Right there, we're on it, see?
Okay.
This is the ultimate white, and then it goes to a little darker white.
Okay.
So you can have that white that looks natural. And then what I do is I have to prepare the teeth in a certain fashion so that Peter can successfully make that smile look a certain way. Now let him describe that a little bit.
It's so important to be able to understand how to prepare the teeth in order to allow me to be able to do the work to sort of come through the color that they're looking for. Obviously, using materials that they're ideal. For instance, we're using Zermax, Emax, Zermax CAD blocks, or Emax lithium disilicate materials. These are materials that actually lend themselves to give you beautiful color and make it really come through.
And if you're looking at your television right now, you could see for yourself the drastic difference. I mean, from left to right there.
Right. And
there is a difference,
and you can see how that white looks natural in that patient's mouth.
Right.
And that's the key, and that's one of the key things with oral design and my skills. It's a marriage of my skills and his skills. So doctor, technician, we're looking at the face, we're looking at skin color, hair color, eye color, we're looking at facial features, but that's how we design that white along with the shapes, so that, if you look at my teeth, I have 22 veneers. And you'd think they're my own teeth, but they're veneers. But the way Peter designed them, he did it in such a way that they just look like they're bleached, but they're really veneers. I have 22.
Oh my God!
I would never, ever know
They look
that.
great. Doesn't he look great? Look at that smile. Wow.
Contagious.
And we love doing it every day.
Well,
Absolutely.
Every day. In fact, we're going to go back to the office after the segment here, and we're going to go do two custom shade analysis, and that's why since Peter's here, we said patients should come in, and he flew in for that, and we're going to go do it after this.
At the end of the day, the excitement is truly the reward, is watching the people smile afterwards, and you see the transition before and after, how they sort of get this sense of empowerment, confidence.
You better believe it. I mean, do you know what a gift you are giving? That is.
Well, yeah, and you've brought people on here before, and they're holding back tears when you ask them, how do you feel? You know?
Exactly. It's a tremendous transformation, and you'll see what happens. And I mean, you can't guarantee it, but people do change. They develop new relationships. They do better. I tend to say that most people just do better after it.
You're happier.
Because they just have it comes out of them. It's a very emotional thing. It's emotional for us. It's emotional for them. And then every time, people come to our office and they like coming to our office. How often do you see people like, I hate going to the dentist? But they come to our office, hey, I love coming here. It's a great place.
It's definitely an experience,
Well, everyonelovesmysmile.com. The website couldn't be more fitting. Thank you guys so much for sitting down with us.
Thank you for having us.
Yes.
Thank you.
Thanks for all that you do.
Yeah, absolutely.
Keep on keeping on. And I
Thank you.
look forward to hearing about this consultation next time you're on today that you're going to do.
We'll do that.
That's right.